Hello, Professor Munson and my fellow classmates. Thank you for reviewing my research proposal, and I welcome your input. My topic is providing public administrators with practical strategies for the retention of public sector mental health providers. The research question is to understand leadership factors contributing to licensed mental health professionals willingly remaining employed in public sector for 3 or more years. The dependent variable is the retention of licensed mental health professionals for a period of greater than 3 years. The objective: complete a critical analysis of the perception of leadership by licensed mental health professionals employed in public sector and describe public service motivation of the licensed mental health professional employed for 3 or more years. The research will potentially strengthen the guidance and recommendations for public sector retention of mental health providers and serve as the foundation of a tool that will outline retention strategies to be used by public administrators. The public policy issues of our time intersect with the need for mental health providers to sustain any national policy gains. Public policy agencies, such as the National Institute of Health, Centers for Disease Control, and Department of Health and Human Services, are all essential contributors to social policy issues, such as human trafficking, refugee and humanitarian assistance, human rights, global women's issues, global health, COVID-19 recovery, all of which require expert mental health providers at the table for effective, sustained change. Public administrators need practical, real-life strategies for retaining these providers. The research serves as a foundation for the evidence to suggest this research is necessary. The literature is a foundation confirming the necessity for this research. First, turnover. There is a high rate of turnover amongst public health administration. Piatek 2017, public administrators now more than ever need strategies to help them provide direction for the desired organizational outcome. Boyne 2010. There is a high average annual turnover of public health within the public health system of about 30%. A major barrier to quality mental health delivery is the limitation of licensed healthcare providers. And then mental illness prevalence is on the rise. More than 1 in 5 United States adults live with mental illness. Over $800 million has been invested by the federal government to address mental health crisis to try to improve the delivery of evidence-based services and equitable access to all Americans. Public health administrators need public sector focused research. Public administrators would benefit from an understanding of the leadership strategy specific to public sector. Why? In order to effectively respond to the country's mental health crises and respond to public policy needs, we need to understand leadership strategies specific to public sector environments. Boyne and Walker emphasized the need to focus specifically on the experience of the public sector employee because employee motivations and organizational objectives in public sector are unique in comparison to private sector. There are unique elements in comparison to private sector. The employee motivation in the private sector is different. Therefore, the research needs to be geared specifically to public sector. Again, Piatek 2017. Leadership style matters. Leadership in the public sector is positively and consistently related to performance and negatively associated with turnover. The perception of leadership is one of the most significant variables impacting engagement of the public sector employee. Norfell-Hylton 2022. Transformational leadership, often suggested as the most beneficial leadership approach, leadership style in public administration. Moynihan 2013, Norfell-Hylton 2022. And then public service motivation is understood to be when an employee's commitment extends beyond oneself and one's organizational affiliation, and the ultimate mission is the service of the greater public. Collier 2014, Muhammad 2019, Van Nebeli 2009. So the literature has made it clear. Public administrators are dealing with high and rising turnover, mental health and addiction crisis is on the rise, public sector research requires unique focus, transformational leadership repeatedly shows up as a positive impact on public sector employee engagement and retention, and there are individuals who intentionally desire to work in public sector. The research question that we are exploring today is where are the need to be focused on the gaps. So where are those gaps? Because research questions built out of the gaps in literature provides an opportunity for the enhancement of that the enhancement of the science and the research in that area. The gaps in literature have been identified as the following. There is limited research related to mental health professionals working in public sector, limited research related to public service motivation and leadership approach specific to licensed mental health providers. Retention and recruitment are often researched together. What occurs is when you combine them, the findings are related to both indicators, therefore decreasing the generalizability of the intervention specific to retention. The literature consistently recommends focus on supporting the engagement of public sector employees. However, for few examples, actual concrete examples of support are provided. And finally, the literature often applies a quantitative analysis of widely distributed surveys as the means of collecting data related to retention, but there is limited qualitative case study exploring the actual perspectives of public sector employees. So this research question is responding to the gaps in literature to understand the leadership factors contributing to licensed mental health professionals willingly remaining employed in public sector. The research design selected is an intrinsic interpretive case study focused on building a better understanding of the transformational leadership practices impacting mental health public sector providers. This research will expand understanding and assist in creating public sector employee-informed retention strategies for public administrators to use in a post-pandemic era. The research design selected intrinsic interpretive case study, and a case study was chosen to inform the specific area of retaining mental health providers in public sector. That this case study research design allows for a more in-depth understanding of that specific phenomena, which we know is impacted by many variables. One-to-one interviews and focus groups are utilized so that we can have a more in-depth exploration of the actual life, opinions, behaviors, and experiences of the public sector employees. The data collection will be open-ended, semi-structured, open-ended, one-to-one interviews and focus groups in open-ended questions of licensed mental health care providers specifically employed in the Department of Mental Health for one United U.S. state. Questions are, as stated, semi-structured, standardized, and open-ended. The questions are semi-structured because they're not absolutely identical. The semi-structure allows for some modification of the order and maybe a few of the words so that there's a comfortable and relaxed exchange between the interviewer and the interviewee. The questions designed will specifically relate to public service motivation and the experience of the interviewee. They will be 5 to 7 in number so that we can stay in the framework of 30 minutes for interviews and approximately 90 minutes for focus groups. And they will be conducted by way of phone, in person, or Zoom. The sample size, the sample for inclusion, the desire is sampling is not random, rather it is purposeful to have a more focused exploration into perceptions. The inclusion is English speaking mental health provider working as a paid licensed mental health provider in public sector and employed in the same organization for 3 or more years. Individuals will be excluded, not included if they are in management or had been in management in the last 3 years. All interviews will be transcribed thoroughly, reviewed and coded for identification of patterns and related to leadership, specifically related to leadership and motivation. Outcomes. Relying on inferences to shape the outcomes, the patterns and trends related to leadership and motivation will be sorted and organized. The analysis will seek to identify specific patterns of leadership and infer potential strategies that can be used to potential strategies that can be used to inform retention and provided to public administrators. The strategies will be compiled to identify general recommendations to public administrators. The weaknesses of this study. It is a case study in which is often critiqued to lack generalizability related to the potential for limited sample size. However, the case study format will expand the knowledge base and value because of the lived experience of the perspectives, and the sample size will be, the focus group was added to expand the sample size in addition to one-to-one interviews. The design is limited in the ability to make causal inferences, rather having to remain at making descriptive inferences, as there isn't a strong theoretical foundation at this time. And so we're currently going to work to build the literature. The mitigation is to design the study with capacity for replicability, potentially enhancing the observable patterns and trends where potential causal inferences may be possible in future research. Selection bias is also a risk that can be mitigated by interviewing mental health clinicians inside and outside of public sector. And the strengths are, we are exploring areas that have not been previously explored in terms of public sector, mental health providers in public sector, and retention strategies from the actual lived experience, expansion of awareness of recommendations for retaining mental health providers in public sector, and we're getting the actual lived experience in as opposed to quantitative surveys. Thank you.